Welcome to the Hormone Hub, your go-to source for the conversations every woman in her 40s and 50s needs to have. I'm your host, Kylie Pinwell, your nutritionist helping you navigate your way through perimenopause, menopause and beyond so you can say goodbye to the endless fatigue, unexplained weight gain, hot flushes, PMS, mood changes and more that come on this hormonal roller coaster. If you missed the memo or think this is only for women of a certain age, ladies, it's time to think again. Now sit back, relax, and enjoy the show. Don't forget to hit subscribe so you don't miss any of my latest episodes, which are released every week. Share it with your friends, your sweaty sisters. The more we talk, the more we help each other. Hello, and welcome back to the Hormone Hub podcast. I'm your host, Kylie Pinwell, and today we are going to talk about the unspoken side of menopause. So, all the things that no one tells us, no one's talking about, but is very real for so many women. So, and I think opening up this conversation normalizes what women are going through. And, the more that women start to realize that this is part of it, they're not going crazy, they're certainly not alone. And there's also a lot of support out there as well. So when it comes to menopause, some of the physical symptoms that we're familiar with, that we tend to associate menopause with would be, hot flushes or hot flashes, vaginal changes, weight gain, mood swings. So we tend to sort of have this picture of what a crazy menopausal woman looks like. But what I want to talk about is some of the not so well-known things. Of course, there's many varying factors that impacts your experience of menopause. And, when I'm talking menopause, I'm also talking perimenopause as well. Some of the varying factors include your general level of health and well-being. So you've got to get those foundations right. So good nutrition, good lifestyle, manage your stress, all of those things that I talk about all the time. But if you've had a previous history of anxiety and depression, if you've had diagnosed chronic conditions that you're managing, it's all going to impact your general level of well-being. Certainly lifestyle choices, like I said, and whether you've had a natural menopause or a surgical or chemotherapy-induced menopause. And I don't think this is talked about enough either. So no two women are the same, and we're all going to experience different menopausal symptoms. 30% of us will sail through menopause with no symptoms. A period will just disappear. About 40% of women will experience sort of mild to moderate symptoms. Things are going to be annoying. You're going to notice it. And then about 30% of women are going to have severe symptoms that are going to impact the quality of your day-to-day life. And certainly women who've had induced menopause, either by a hysterectomy, so surgical menopause, or as a result of chemotherapy treatment, you might find that your symptoms are more severe because you're put into a sudden menopause. So it's a bigger shock on your body. And certainly, if it's appropriate for you, there's lots of bioidentical HRT options that are worth speaking to your doctor about, but that isn't appropriate for everyone, particularly if you've got a history of hormonal cancers and things like that. It might just not be an option for you. So again, this is where we go back to what we can control. So we can control our nutrition, our lifestyle, our mindset to get those foundations right. And that's going to support you as much as you can. Okay, if we have a look at some of the common physical symptoms, things like hot flushes. So even these, I said we were going to talk about the ones that weren't necessarily talked about very often, but it's just sort of worth mentioning that the cause of hot flushes isn't completely understood. It seems that lower estrogen levels affect the part of the brain that provide the thermostat for body temperature. And there's a lot of studies that show that stress, anxiety can influence the frequency of and the intensity of hot flushes. And definitely there's certain foods, also alcohol is a big one that can have an impact as well. They generally sort of start that chest area, spread to the upper chest, neck and face, but it can happen over the whole body as well. Now, even women within that can experience hot flushes differently. Some women will have mild and quick hot flushes. Others can have one a day or more than 20 a day. Other women get night sweats, like either on top of or instead of their hot flushes, where they literally wake up in a puddle. It can happen a couple of times for some women, and for others, it can last for years. Other common symptoms are fatigue and tiredness, which I talk about all the time, not sleeping, so that insomnia and wakefulness. Weight gain is a big one. I've done episodes and episodes on that. Aches and pains. So we get that sort of low level of inflammation, bloating and constipation as well. It definitely impacts our digestive system. So I think it's safe to say that menopause can be a whole body experience. Now, jumping into some of the lesser known symptoms. So the things that I get asked on a fairly regular basis. It's actually not all that uncommon, but we're just not talking about it. One of them is like crawling, sort of like dry or an itchy skin. So you've got this crawling sensation. Now, definitely what they know is, that lower level of estrogen can influence our perception of touch. So that means that we can be extra sensitive to touch or even numb to touch at some time. It's sort of like a nervous system response. Another side effect or symptom that we're not talking enough about is the impact that headaches and migraines can have on many women. Now, generally, this is sort of worse in perimenopause, sort of in that lead up to menopause. For some women, it persists post-menopause as well. So what happens? We get a buildup of estrogen and our body naturally has a decline in progesterone. So it's that imbalance of the ratio of estrogen to progesterone. So what we want to do is make sure that our liver is working well to clear that excess estrogen, but also we want to support our body's natural production of progesterone as well. So again, that's something with clients I would do through nutrition first, always, stress management, 100%, and then have a look at, do we need supplements in this case? We look at sleep and also food sensitivities, which is interesting. So some of the nutrients we look at here are definitely magnesium and increasing your dose. You're getting a big therapeutic dose from kind of ovulation through until your period starts. B vitamins are really important at this time, and also curcumin. So that's a natural anti-inflammatory. So you can sort of take these without too many side effects. Now, for some women, they might not be responsive to this, and definitely a bioidentical form of progesterone is indicated for those migraines as well. So don't be afraid to ask your doctor, put your hand up, be an advocate for your own health. This Hormone Hub episode is sponsored by the Well-Balanced Woman. If you've been on a hormonal roller coaster, feeling bloated, your digestion isn't the best, and you know you're sick and tired of feeling lethargic with your weight creeping up, then this is the right program for you. I'm right there with you across the 12 weeks to hold your hand, and I'll give you a loving kick up the bum if you need it. The Well-Balanced Woman is your personalised 4-phase program created to help you regain your energy, balance your hormones and fire up your metabolism so you get the results you're after. The link with all the details is on our show notes or over at kyliepinwell.com/wellbalancedwoman. Now, the next one I wanted to talk about is sore breasts. So for some women, it can be like when they're pregnant, back to pregnancy days. Some women experience tenderness. It can be burning or soreness. And this can be right through perimenopause and also into menopause, particularly if you're on HRT. For other women, it can be a stabbing, sharp or a throbbing pain. It can be just in one breast. It can be in both breasts. We tend to worry immediately with any symptoms concerning our breasts, and definitely that's a natural response. So I encourage you, try not to panic. Just because you have suddenly breast pain and tenderness, it's rarely an early sign of breast cancer, but definitely if you're worried, always speak to a doctor, and especially if you find a lump, if there's any change in the appearance of your breast or nipples or any sort of nipple discharge, always get it checked out. But generally that sudden pain doesn't necessarily mean it's not a one-way ticket to breast cancer either. Now, For some women, that breast pain, that breast tenderness goes away after menopause. But like I said, HRT can continue that hormone stimulation. So that's why some women post-menopause can have that breast pain as well. Now, there is a bit we can do here. So definitely there's lifestyle changes to help relieve that discomfort. One of them is having a look at your salt consumption and also drinking more water. So even if you're mildly dehydrated, that can trigger fluid retention, which may worsen the breast pain. I also get women sort of describing how their boobs have exploded as well. That would be my first port of call is, are you drinking enough water? Avoiding caffeine can also help to reduce tenderness, and taking stock of how much body fat you actually have, because it's reducing body fat, and I'm not talking kilos on the scales, overall body fat, because the more body fat we have, because we tend to carry estrogen in our body fat, and the breasts are a first port of call for where estrogen will lay down body fat. Be mindful, but also take stock. Is that something that you need to address? Iodine certainly can be a treatment in perimenopause that's appropriate for some women, but definitely not if you have Graves' disease or anything like that. It's not a one-size-fits-all, but it's definitely a treatment consideration that I would consider for my clients, but after having the chat and ideally having iodine levels tested. Now, I want to make special mention of urinary, vaginal, and vulval changes. So this is definitely something that is very common, and we are not talking enough about it. And ladies, I do not want you to suffer in silence. I'm trying to nail down a couple of guest expert speakers to come in and go into more depth in this. Definitely low estrogen causes changes to our vulval vagina, also our bladder as well. We can experience genital dryness, so both vaginal and vulvar dryness. It can feel like burning. It can feel irritation. A lot of women notice that it impacts their sexual function. So with a lack of lubrication, discomfort or pain wearing jeans, impaired vaginal function, or loss of vaginal elasticity. So if you, like I said, feel uncomfortable wearing jeans or tight pants, or things just don't feel comfortable, it's always worth getting that checked out. UTIs, and the interesting thing with thrush and UTIs, so thrush tends to come in perimenopause. So if we think that thrush loves estrogen, they kind of go together. That high sort of levels of circulating estrogen tends to be more common in perimenopause. So thrush, that's what we see then. Then post-menopause, when your estrogen levels have dropped, that's where we tend to see more vaginal, what's it called? There's my perimenopause brain losing my words again. We see urinary urgency, pain, recurrent urinary tract infections, bacterial vaginosis. That's what I was trying to think of. We tend to see BV post-menopause. That's where talking to women, getting a good history, their signs, their symptoms. Not everyone knows that they're in menopause, because if you've got on the pill or an IUD and all of a sudden you're getting UTIs or you've been swabbed and it's bacterial vaginosis, that's a good sign that you're in menopause. So it's just good to be aware of that as well. Certainly pelvic floor prolapse, leaking. This is all caused by that drop in estrogen, which affects the ligaments that hold our uterus, our cervix, our vagina, our bowels, our kidneys in place. Those ligaments sort of lose their elasticity with the change in hormones. So definitely worth, if you've got any concerns, to go and see a pelvic floor physio. We did have a great episode. We had Kath Bakui, who is a pelvic floor physio, come on the podcast a month or so, maybe a couple of months ago. So certainly Google my podcast, Google pelvic floor, and Kath's interview will come up if you want to find out more about that. Now, the next one I wanted to talk about was how menopause can affect our mood. Okay, so we can definitely feel low, we can feel more depressed and feel the experience of changes in mood, definitely through menopause and when your hormones are fluctuating. So it's important to kind of step back and think, menopause doesn't cause depression, but certainly if you've had a history of depression before you sort of hit perimenopause, menopause, or if you've had a history of PMS, postnatal depression, PMD or PMDD, you might, or you're more likely to be more sensitive to the hormonal changes that are going on. I just want to say, there's absolutely no shame in taking antidepressants or anti-anxiety medications where there is appropriate. And definitely, it's certainly warranted. But I also, on the flip side of that, want to say that these are often commonly prescribed as a first port of call. So women know that something's not right, you're not coping with things as well as you used to, or things that would never have bothered you before are now bothering you, and you're getting upset. You might have increased anxiety over things. You might be worrying more. You might just feel overwhelmed by life. Often go off to the doctor, nothing's wrong. Oh, well, here you go. And you're handed a script, which is fine if you feel that it's actually depression. But I speak to a lot of women and, they kind of know within themselves that it's not actually depression. Remember that a lot of medications can mask or numb the problems and also cause more side effects. So what's really interesting is statistics show an increase in people suffering from depression. So it's 100%, that's not a question. And then parallel to this, the use of antidepressants has increased by nearly 400% over the last 2 decades. So you would think, and this is a Harvard study, by the way, so the number of patients diagnosed with depression increases by approximately 20% per year. So if medication alone was the answer to depression, and, antidepressant uses increased by 400%, then the numbers of people suffering depression should be going down, not up. Okay, so there's a lot of people out there on antidepressants who actually aren't depressed. All right. So, and like I said, I'm not antidepressants, anti-anxiety is 100% warranted, but it shouldn't be a Band-Aid, and it shouldn't be just, here's a script to shut you up so you don't come back sort of thing. I want you to sort of get better at learning to recognize stress and the effect that it has on your body. So when we get better at managing our stress, leaning into how we're actually feeling and trying to sort of discern, I guess, are we just low or is it something more? So then this is something that I talk about all the time. But definitely we are more susceptible during this time, of course. It's part of the emotional sort of bundle. It's common to have low, flat, or even swinging kind of moods. So if you are feeling more irritable, and I also think, are we just more irritable, or do we have just less tolerance for what's going on? So sometimes I think that's me. I'm just tolerance level 0, depending on the day, of course. Anyway, so I hope you found that helpful. So they're just, look, and I could talk for hours on 100 other symptoms that we're just not talking enough about. But hopefully that gives you a starting point so you can sort of recognize some of those things that might be happening for you. And you can go, yeah, okay, I recognize that, and come up with an action plan of what to do as well. I always recommend start with the basics: good nutrition, lifestyle habits, mindset. They're the 3 foundations that we need to work on. All right, my loves, much love. See you in the next episode. Thank you for taking the time to listen today. You can head on over to the show notes at kyliepinwell.com/podcast, where you'll find all the links, and I have a little bonus surprise waiting for you. Before we go, it would mean the world to me if you head on over to your favourite podcast channel, subscribe and leave a review. Make sure to screenshot it, DM it to me so I can thank you personally. Then stay tuned for next week's episode. Can't wait to see you then.